This presentation educates child care centers on best practices so they can support families who choose to breastfeed. We respect all families regardless of their infant feeding decision, while recognizing the unique role child care centers can play in supporting breastfeeding as a public health effort. Care providers can reduce a breastfeeding mother's anxiety by welcoming breastfeeding families and providing a staff that is well trained in the proper handling of human milk and feeding of breastfed infants. More families are looking for child care providers who are knowledgeable about breastfeeding and supportive of their efforts to exclusively breastfeed for 6 months. Your acceptance and support of breastfeeding is a way to market to these families while doing your part to align with national childhood health initiatives. There are many ways that child care centers can welcome and support breastfeeding families and educate and encourage those still deciding on baby's first foods, including policies and care plans for breastfeeding infants, highlighting staff expertise, and inviting mothers to breastfeed and pump at your location are easy ways to let families know that your facility is breast milk friendly. Provide referral lists to La Leche League, peer counseling support, and local lactation consultants in your welcome packet, so families know that you are part of a larger community of support around them. Create an environment where breastfeeding is normal and natural. Offer books about mammals and how mammals feed their young, and consider displaying artwork and posters showing mothers and babies nursing. Breast milk provides over 800 components that help a baby's immune system mature as fast as possible. Breast milk changes day to day and even hour to hour to quickly produce antibodies to protect a baby from germs and bacteria in their environment. This helps prevent illness. Sometimes moms worry if they should continue nursing if they have a cold, a stomach bug, or the flu. In fact, the best thing a mother can do is to continue to breastfeed so the baby can get the best antibodies possible to prevent or lessen an illness. This helps all the children in your care, as well as child care center staff, to stay healthy. Expressed breast milk appears more watery than formula, sometimes with a slightly bluish color. Because it's not homogenized, it will separate into layers, with fats rising to the top, so you can expect a frozen bag of breast milk to have color or density variations. Breast milk handling and storage is easiest if mothers freeze milk in 1 to 4 ounce quantities, so the care provider can thaw milk to meet baby's specific needs while minimizing waste. Moms must label milk with their infant's full name and the date and time collected. This helps the care provider keep the freshest milk in rotation. Encourage mothers to bring a backup supply of milk to store in the freezer. Some mothers have extra frozen milk they can bring in, while others may not. Having even just a little bit of extra milk for days when the baby is having a growth spurt helps maintain exclusive breast milk diets. Remember that communication is key. Recording how much the baby is eating lets mothers plan accordingly with their pumping and nursing schedules. A positive team approach will help everyone feel encouraged and connected to the process. There are several options for preparing milk for consumption. You can defrost the breast milk in the refrigerator overnight. You can hold it under running water or submerge it in a bowl of water. As it thaws, swirl it gently to combine the layers, as shaking milk damages components that are valuable to the infant. Rotate the milk in your collection, using the oldest fresh milk first, then the oldest frozen milk, applying the first in, first out method when determining which to use first. Warm bottles under warm running water. Place them in a container of warm water or use bottle warmers. Temperatures should not exceed 98.6 degrees, so don't leave them in warm water for more than about 5 minutes. Excessive heat destroys infection-fighting properties of milk, so crock pots aren't appropriate for breast milk. Milk should also never be heated in a microwave, as this creates hot spots, which may burn the infant. Both OSHA and CDC classify breast milk as food that does not require universal precautions for handling body fluids. This means you cannot become contaminated by touching human milk. You do not need to wear gloves when feeding or handling human milk, and there is no need to store human milk in a separate refrigerator. It is important to have policies and procedures for keeping the breast milk safe, and especially to ensure that each baby gets the right bottle. Some childcare providers use color-coded labels so that each child has a certain colored label on all of his or her food and drink. Timing for feeding bottles is also an important part of the team effort to support a breastfeeding mother and baby. It is common for moms to nurse just before drop-off and/or at the end of the workday. Talk to moms about this and check in about it every day. Babies are far more efficient than breast pumps, so many mothers depend on the drop-off and pick-up nursing feeds to maintain their milk supply. Making sure that babies are ready to nurse when the mother arrives, if that's what she's expecting, is very important. As long as the baby has not fed from the container, and as long as you follow the storage guidelines, you can refrigerate, freeze, or return milk that the baby didn't drink that day. Another important part of the team effort is to keep track of the amount each baby drinks, how much is discarded, and how much is returned to the family at the end of the day. Most child care centers have a system for recording this type of information for all babies. However, consumption patterns for breastfed babies will be different than formula-fed babies. Just as hunger cues are important in initiating feedings, observing satiety cues can limit overfeeding. Cues that the baby may be full can include turning away from the bottle nipple, increasing attention to their surroundings, keeping their mouth closed, or simply saying no. Holding a baby in an upright position with the bottle parallel to the floor helps reduce the risk of baby eating too much or too fast. At the beginning of a feeding, touch the bottle to the baby's lips and let the baby draw it in himself. It is important to give babies breaks and pauses as they eat. This is called paced bottle feeding. A slow flow nipple can really help. Growth spurts can be anticipated at around 10 days, 3 weeks, 6 weeks, 3 months, and 6 months, lasting about 2 to 3 days each time. During these times, babies will show more frequent feeding cues. If mom and baby were not separated, baby would adapt by nursing more frequently. It can therefore be helpful for mom to pump and nurse more often, and for child care providers to encourage her with reminders that growth spurts only last a few days. We know that the majority of U.S. mothers want to nurse, and that human babies thrive with human milk as their first food. Caregivers have a unique opportunity to support breastfeeding mothers. Breast milk feeding can also save your child care center money. Breast milk is part of the meal pattern if you participate in the Child and Adult Care Food Program. Breast milk can be reimbursable as a component of the infant meal pattern if fed to infants by their care provider. Breast milk is also free, nothing for you to buy, which means more money in your pocket. For children over 12 months, breast milk may be a substitute for cow's milk in the meal pattern. To accomplish this, a doctor's statement is required. You should know the laws that support breastfeeding. Most importantly, there's a new national law that amends the Patient Protection and Affordable Care Act and states that employers shall now provide breastfeeding hourly employees with reasonable break time and private non-bathroom locations to express breast milk during the workday up until the child's first birthday. As more mothers access workplace accommodations for milk expression, more families will be looking for breast milk-friendly childcare centers. Breastfeeding is the foundation of a healthier community. Make sure your care plans and policies support breastfeeding. The work that you do is really important. Thank you for actively supporting families who want to breastfeed.